This is Healthcare Today with your host, Kelly Roberts.
Hello, welcome to Healthcare Today. In today's show, I'll be joined by the physicians from Albany Urology. My first guest is Dr. Michael Daugherty, board-certified physician at Albany Urology. Thank you for being here.
Thanks for having me.
We're going to focus today on men's health and health issues that concern the male population. So I know the first thing that we want to talk about, probably you hear most commonly, people asking about prostate cancer.
It is. It's probably one of the most common things we see in our clinic. You know, it's the most common cancer in men in general, and it's something that we treat every single day in our clinic.
Okay, so at what age should someone be screened for prostate cancer?
In general, we tell men at the age of 50 they need to get their first PSA screening, which typically involves a blood test called the PSA and also an examination of the prostate.
Okay, and then is there anybody that's at risk that definitely needs to make sure they're being screened?
Yes, yeah. There's several groups that are high risk. People that have it in the direct family history. So we want those men to come in to get screened at the age of 40.
Okay.
Also, African American men tend to get prostate cancer at an earlier age, and it tends to be more aggressive. So those two groups of men especially need to come in early to get their first PSA, somewhere between 40 and 45.
Okay, and like you said, it can start off with a simple blood test too,
yes,
right?
Yeah, if somebody's thinking they don't want to come in because they don't want the examination, then I think just getting the blood test will catch about 80% of the prostate cancers, and if somebody's test turns out to be abnormal, we can always work on doing the examination at a later time.
Right. Now, are there any symptoms somebody may be experiencing?
There can be symptoms, in early prostate cancer, the kind that we find with the blood test. Typically men don't have any symptoms. They're just totally normal. They don't feel anything. In more advanced prostate cancer, they will tend to get painful urination, urgency, maybe blood in the urine, pelvic pain. So you can get symptoms, locally if the prostate cancer is more advanced.
But another reason, if you can have it and not have symptoms, another reason how important screenings are?
Yes, yeah. You don't want to wait until you're starting to have symptoms before you come in to get your first test. You need to come in, get it done while you're healthy and not having any issues, and it's a lot more treatable at that point.
Okay. Well, unfortunately, if it's common, then that means some will test positive. So let's talk about some treatment options.
Okay. Typically for localized prostate cancer, that means cancer that's only in the prostate. Once we find it with a biopsy, we usually recommend doing some scanning, either to test the bones or the pelvic area with the CT scan to make sure it hasn't spread already. And once we know it hasn't, then we can kind of divide men into different groups. If it's low-grade prostate cancer, which means maybe only one or two little spots in the prostate that are not very aggressive, nowadays we're watching more men than ever before, and we're just doing something called active surveillance, where they come in 3 or 4 times a year for a blood test.
Okay.
And if their blood test ever starts to elevate or go up, then we can always move them into the more active treatment groups. The most common active treatments for prostate cancer would be surgery to remove it, or radiation therapy, where we leave the prostate but radiate it in different ways.
Okay. And do y'all do some of those procedures and tests there at the surgical center?
We do the testing there, all the biopsies, all the scanning. We do all that in the surgery center and in the office. If someone needs to have radiation therapy, they would typically see the radiation oncologist at the hospital, or of course if they need their prostate removed, would go to the hospital for that.
And do that. So again, they can, just because they come in and get screened, they still, it's so important to have it done early.
Absolutely. The earlier, the better. It's much more treatable if we find it before it spreads.
And how have options changed since you started practicing to treat this disease?
Well, yeah, when I first started practicing, we did all of our prostate removals in an open way, kind of old-fashioned surgery where you make an incision. Nowadays, I think in the country, about 85% of all prostate removals are done robotically. The technology for that is light years different than what it was 15 years ago, so it's really unbelievable way to do surgery.
So does that mean too with the robot they'll have less downtime? And
yes.
Tell me some of the benefits of that.
Yeah, most of the men that have their prostate removed robotically, maybe are in the hospital a day or two. They have to wear a catheter for about a week just to let everything heal up, but their recovery time is probably more like 2 or 3 weeks as opposed to 6 or 8 weeks to getting over an open incision. So That part is
much better.
Much better.
And again, I want to go back because they need this blood test done. And what does PSA stand for?
It stands for prostate specific antigen, and what that is, it's a chemical that's produced in the prostate, and so we know if that chemical is overproduced, one of the reasons for that is cancer. Having a high PSA doesn't mean that you have cancer, it just means that we need to check you a little bit closer and find out if you do.
Okay. And again, we just want to go back to every male needs one starting at age 50.
Yes.
Unless they have a risk factor.
Yeah, family history or African American, we ask those men to come in earlier and get their blood test done, somewhere between 40 and 45.
Okay. All right, now I want to switch to a different topic. So let's talk about OAB. We often hear overactive bladder, and sometimes we think first women, but that is not the case.
No, it's more common, I think, in women, just in general. In men, we also see the same symptoms. You know, the bladder can be affected the same way. In men, sometimes it gets to be a little more complicated because you're trying to decide, is this due to the prostate being enlarged, or is it due to the bladder that is not completely normal?
Right, and so let's talk at some symptoms, because it might be hard to realize, hey, I'm actually going more than I should be.
Yes. Yeah, we think if you're going more than 8 times during daytime hours, that's probably abnormal.
Okay.
And then at nighttime, it varies. You know, some people are really disturbed if they get up once, but other people can get up 3 or 4 times. So we actually just kind of say, if you're getting up enough that it disturbs your sleep and you're not able to go back to sleep, that's affecting your lifestyle, that's probably too much.
And that's probably a good point, affecting your lifestyle, is that they don't go to the movies because they can't see it, or
Absolutely,
events.
yeah. People really get concerned about being caught in a position where the bathroom is not close by. You know, things that we hear as church, grocery store, mall, you know, going out, even going out hunting somewhere where you're out in the woods and you're having a problem. So, you know, it can be a real issue.
Okay, and then so now with that as well, you have treatment options. That doesn't have to be their lifestyle.
No, yeah, there's some really great options nowadays. You know, there's some really good oral medications for overactive bladder. We use that as our first line therapy, and so those are very effective. Nowadays those medications have less side effects than ever before, so people seem to tolerate those really well.
Okay, good. And then if that doesn't work, you have another type of therapy you can offer?
Yes, we can. Go ahead.
No, I'm saying you actually have an overactive bladder clinic in your
practice.
practice.
Yeah, we have established some pathways in our office where when people come in with overactive bladder symptoms, we can make sure we're putting them in the right position to get the best treatment that they can. We've got a nurse navigator and a nurse practitioner that concentrate on this area and help get our men and women to the right place for treatment.
And I imagine that's helpful, especially since sometimes emails are very difficult to
It
go
is,
to the doctor.
yeah. It's good to have somebody kind of following up, and we'll call them and say, hey, how's the medicine working? Is there anything we can do? Do you want to come back in and talk to the doctor? So it really does help to have a follow-up call and somebody that is working on getting you back in when you need to.
And that brings me to another point when I talk about what's your advice for men? It's kind of hard sometimes to come and talk about this subject, but it's so important.
It is, and you know, just I think in general getting men to the doctor is difficult, no matter what the issue is. But if you're having a problem that is affecting the way you live your life, there's things that we can do to make that better, and there's no reason to be walking around miserable when we can make things better for you.
Or embarrassed because you see this day in and out.
Yes,
right?
Yeah, they don't really want to kind of talk about what the real problem is. So, but yeah, just come in and let us know. There's things we can do that'll make a huge difference in your life.
Right. Well, I appreciate your time. We're going to take a quick break. Stay tuned. Stay tuned, and we'll be right back.
If you're a health professional and would like to learn more about becoming a guest on Healthcare Today, please contact Kelly Roberts at 446-4074 or email her at kelly.roberts@waob.com.
33 million Americans suffer from overactive bladder every day. This accounts for more than 40% of the women in the U.S. Do you run to the bathroom or go more than 8 times during the day? Is your sleep disturbed by your bladder function? If so, you may have overactive bladder. We offer many treatments from behavioral therapy to medical therapy, as well as many advanced therapies such as surgery, Botox injections, and bladder nerve stimulation. If you are suffering from overactive bladder, please call our office for an appointment and see one of our specialists today.
One of the hottest topics in the news these days is low testosterone. It can present with something as easy as a little fatigue and not having the energy you used to. Here at Albany Urology, we specialize in treating people with low testosterone.
Call Albany Urology or log on to their website today.
You now have the power to prioritize your Facebook feed and get local news and information from the team you trust. Go to WALB News 10 on Facebook, give us a like, then click following and choose See First. That's it. Customize even more by choosing notifications. Choose posts, live videos, breaking news, anything you want to see in real time. Take control of your news feed and stay connected to what's happening in your community with WALB News 10 on Facebook.
Welcome back, and once again, I'm joined by the physicians in today's show from Albany Urology. My next guest is Dr. Michael Monahan, board-certified physician with Albany Urology. Welcome.
Thanks.
Thank you for being here today.
Sure.
And we're talking a little bit about some health issues and concerns with the male population. So one common thing you probably hear, or we often hear, is associated with males is the low testosterone. Talk to me a little bit about that.
Yeah, so low testosterone is fairly common. About 60% of men over 65 will have a low testosterone level in their blood.
Okay.
We estimate 4 to 5 million people in the United States do have a low testosterone. Not everybody is symptomatic, but if you do test those numbers, they are low.
Okay, and let's talk about some of those symptoms. What are some symptoms of low testosterone?
Yeah, sometimes we'll see loss of libido, weight gain, low energy, maybe some bone health issues. Irritability are the biggest issues. The way I like to think of it is, it affects the brain, it affects the blood or the vasculature, and it affects the bone.
Okay, so now how is someone screened or tested for that?
Yeah, a lot of times it's what patients are feeling if they're symptomatic, and primary care doctors are the first ones to kind of notice that, and then they'll send them our way if it is low. A screening testosterone level is the biggest way to find out if patients are hypogonad or have low testosterone.
Okay, and when they screen, is that through a blood test?
It is. It's a blood test. Usually we'll obtain it in the morning because testosterone is very cyclical. So in the morning it's the highest, and that's where we want to get it.
Okay. And then, like you said, if that's normal, then they're okay. If it's abnormal, they come your way. So let's talk about what are some treatment options?
Yes, it's a variety of treatment options. There are gels out there. There are injection shots out there. There are pellets that we can place into the patient to have a long, steady dose of testosterone that are out there. And there's sublingual that are out there. We don't recommend taking an oral pill, but there are other iterations of, by mouth that we can do.
And is that something kind of like you hear patients when they take thyroid or blood pressure medicine, there's no one, you kind of find the right dose? Is that something you monitor?
Yeah, what the patient wants. If they want something daily, like a pill, we have gels that we can place. If they want something every week or every other week, intramuscular injections, or if they want something more long term, we have the pellets that we can put in every 6 to 9 months.
Okay, and is that a pretty fairly easy procedure, or
yeah, the
minimally
pellets,
invasive?
Yeah, the pellets, we just make a little poke hole in the patient and numb it up and put the pellets in, and it takes 2 or 3 minutes to do.
Great. And then getting back to, you said the age, at any age they could be screened or should be screened?
Screening for testosterone or low testosterone isn't something we normally do. It's based on symptoms. So if the patient, it does exhibit low testosterone or loss of blood or weak feeling or weight gain, low energy, then getting a testosterone wouldn't be a bad idea. But just as far as the whole population goes, we don't normally screen like we would a PSA.
Okay, because they are going to exhibit symptoms, you said, if they have this.
Correct.
Okay, and then what about as far as, for the male population, we talked about once they get treatment options, are you pretty much, is that taking care of it? It gets their level to where it needs to be?
Yeah, we do. We follow their testosterone level, and we also follow a couple other blood levels, like a blood count, because a lot of the times the testosterone can raise their blood count, put you at risk for developing clots. So it's something we do follow.
Okay, and Dr. Darty and I were talking earlier about how men sometimes do not like to go to the doctors, and you see that often.
Yeah.
But we want to stress how important it is.
Yeah, especially if you're not feeling well. If you are exhibiting those, weight gain, low energy, low libido, there could be something that we could fix.
And there are probably risk factors if you go long-term low and don't see about it?
Yeah, the biggest thing we notice is cardiovascular risk and bone loss risk. So fractures can happen if the patient has very low T, and it affects your cardiovascular system.
Okay, and again, it's a simple blood test.
Simple blood test, yep. Like I said, usually in the morning we can get it, and if we do need to do some more testing, we will, but usually it's just a one-time blood test.
Okay, and is family history, is that anything, is that common?
Not generally. The biggest risk factors for low T are obesity, age, of course. As we get older, our testosterone does get lower. Infections, inflammatory conditions, medications like chronic opioids or hormones that patients may be taking could put you at risk.
Okay, so we definitely want to get them back in front of their doctors and have checked.
Yes.
Okay, well that's some great information. We're going to take a quick break.
Okay.
Stay tuned and we'll be right back.
If you're a health professional and would like to learn more about becoming a guest on Healthcare Today, please contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
One of the hottest topics in the news these days is low testosterone. It can present with something as easy as a little fatigue and not having the energy you used to. Here at Albany Urology, we specialize in treating people with low testosterone.
Call Albany Urology or log on to their website today.
Becoming a news leader doesn't happen overnight. Staying a leader isn't a given. It must be earned every single day. WALB has created a news legacy built on experience, trust, and hard work. WALB News 10 brings you the stories that you need to know to keep your family safe and informed. Whether you see our news on air, online, or on mobile, your home for live, local, late-breaking news is WALB News 10.
Having to go a little more than usual? Well, it's not just because you're getting old.
If you feel like you're missing out on life with frequent trips to the bathroom, come see us at Albany Urology Clinic.
When news breaks as severe weather strikes, you need to know now. And no matter where you are, WALB News 10 mobile apps keep you informed. Breaking news alerts sent directly to you. Access to every newscast streaming live to wherever you are. Severe weather alerts.
Monitor what's happening with these particular storms. There is a squall line of strong to severe storms.
Giving you the information you need when you need it the most. Download the WALB News and Weather apps today.
Hello and welcome back. Again today I'm joined by the physicians from Albany Urology. I'm now joined by Dr. Scott Winland, board certified physician at Albany Urology. Thank you for joining me today.
Glad to be here.
Today we're talking mostly about issues that concern men in the male population. We've talked about prostate cancer and low testosterone, but another common thing we hear is BPH. Talk to me a little bit about that.
Yeah, BPH, as you said, is very common, probably the most common problem that we see in men. It's a problem. The prostate is a men's sexual organ, and it kind of sits right at the neck of the bladder, and it can enlarge and cause obstruction and a lot of difficulty voting symptoms associated with it.
Okay, so obviously if it's common, people may be experiencing some symptoms and might not realize that's what it is. Talk to me about the symptoms.
Well, sure, symptoms are very common, and a lot of people just attribute it to, I'm just getting older and I just got to deal with it, but it isn't. They say half of men by the age of 60 and 90% of men by the age of 85 are affected by some symptoms or the other. So if you live long enough, you're going to have problems with BPH. The symptoms start with what we call obstruction. Again, I said the prostate sits and the urethra runs through it.
Okay.
And as it enlarges, it constricts the flow of urine. So people, have a little bit of dribbling, they have a slow stream, it starts and stops, it takes a little longer at a urinal, that's what men will often notice.
Right.
And then it often progresses to what we call the irritative or the bothersome symptoms, and that's the frequency, urgency, you have to rush to the bathroom, you can't hold it, and get up at night, all these things that keep people from doing what they want to do.
Okay, and now how do you screen for that?
Mainly by symptoms.
Okay.
People will say, they'll come, we have a standardized set of questions that we ask that have been that have been validated in those, all those symptoms that we talked about, how frequently you have problems with slow flow, getting up at night, frequency, urgency, etc.
Okay, and once you've identified a patient that has this, what are their treatment options?
Well, like anything, there's a whole gamut. You know, you can do, sometimes we'll just watch it. When people know what's going on, they can understand it and deal with it. There are some herbal or supplements that people can take that may offer some benefits. Probably most commonly we start with medications. There's two different types of medicines that we can give. One that sort of relaxes the prostate and the bladder neck and works rather quickly. One that will shrink the prostate a little bit. It takes several months to kick in, but sometimes we use a combination of the two, and that will help. And then there is a newer treatment out that we can talk about a little bit that talks about some of the new way that we can treat it. And then there's the traditional ones that people have heard of, the TURP. A lot of people call it the old Roto-Rooter, basically a crude way of saying you open up the prostate so that people can urinate better. We do that with electrocautery or cutting.
Okay.
We do it with lasers. In some cases, in extreme cases, we can even do open surgery to remove part of the prostate in very, very large glands.
And typically when they find this treatment, you probably base it off their symptoms and how they're responsive to what you're trying.
Right, and we talk about different options. You know, we're not going to jump to one end of the spectrum. It's usually a continuum of things that we offer people.
But eventually they can get back maybe to a lifestyle. We've been talking about that in the show today and how people avoid and doing events and things that changes their lifestyle because of problems like this.
Yeah, absolutely.
So now let's talk about the newest treatment option. You mentioned the UroLift. Tell me about that.
Well, UroLift is a new procedure that we've recently started doing here. It's been available for a long time.
Okay.
We've got good data out 7 years now in the United States and more than 10 years overseas. And it's kind of a bridge, often can be used as a bridge between medications and behavioral therapy to men that really don't want to go that extra step to the cutting. There's no cutting of tissue or ablating of tissue, so you don't have as many of the side effects. So there are often some sexual side effects, more risk of bleeding and other things with the traditional operation. So it fills a great void in a space that we haven't had anything before. And sometimes men can't take the medicine. Either they're too expensive, there's too many side effects, or we just don't like taking medicine every day. And a lot of men are of the opinion if we know what's wrong and we got something that can fix the problem, let's fix it. Let's not just throw medicines at it. That's right.
So tell me about now the actual procedure itself.
Well, you know, the prostate, as I said, kind of is a gland that sits at the bladder neck. The urethra runs through it, so as it enlarges, it constricts it. The UroLift is a device that we place without any cutting or ablation of tissue. We have a camera, we go look into the prostate, and it has a suture that will actually open up the prostate. I say it's almost like pulling curtains. On each side, it spreads it open and allows people to open up their channel and help almost immediately with the obstructive symptoms, and then pretty soon thereafter, the other irritative, the burning, frequency, urgency symptoms get better as well.
Okay, now is this something you do there at your surgical center?
Yes, yeah, we do it right in our office at our surgery center. We do give an anesthetic for it, so there's no pain associated with the procedure.
Right.
It's a very quick recovery. You know, you have a little bit of discomfort for a few days, but men can be back to doing whatever they want to do, usually within a week or two.
And it's just minimally invasive, like you said, and just kind of the benefits outweigh dealing with the problems.
It's a great procedure. There hasn't been anything new that's really caught our attention like this procedure in quite some time. We're very excited, and patients are very excited about how quick they get better.
Sounds like a great option. So let's go again. Like, who's the candidate for this? Is it somebody probably that's failed on medication therapy?
It's someone that, you know, we put people through a pretty rigorous screening profile to see if they're a candidate, because we don't want you to have the procedure if you don't need it, and we want to make sure it's going to work. And when we follow this, you know, we know it does work. We look at a certain size prostate will work, and certain anatomy of the prostate will work. And then you have the symptoms that we talked about. You have difficulty voiding. We'll often do some specialized tests where we actually have men urinate in a special machine or container that will tell us the flow of their urine to make sure that they really do have obstructive symptoms. And once you go through that, if you meet all these criteria and you have no other significant medical problems that would preclude you from doing something like this, you're a candidate and could do real well with it.
And talk to me a little bit, you mentioned another procedure. This is way more, it sounds like this is a much easier procedure.
Yes, yes.
So it definitely outweighs the benefits of doing this versus the old traditional way?
The traditional way, and there's still a role certainly for the TURP, we call it, to trim out the prostate. It's just a lot quicker recovery. In a traditional TURP, most people are in the hospital a day or two afterwards, and a lot higher risk of bleeding, a lot more side effects down the road. It works. It's a great operation for men that need it, but maybe you don't quite need all that. And if you have this procedure, there's nothing to say 5, 10, 15 years down the road you can't still do something else to the prostate, but it kind of gives you more time.
Do they see kind of immediate benefits or like results?
Yeah.
Talk to me about that.
Almost immediately. You know, like I said, there's some irritative symptoms the first few days, but the flow improves almost immediately. There's a little swelling that goes on for a couple of weeks afterwards, but it's been really remarkable. Men have been real happy with it.
Any follow-up care they have to do after that, or once they've kind of healed from it?
Once they've healed from it, it's just a routine health screening that was been talked about a little bit earlier this afternoon.
So again, we want to push men to go to the doctors.
Right.
And Dr. Daugherty touched on this earlier, but I want to talk about it again. Often the male population has a hard time forthcoming with the issues they have. So I'm asking, what's your advice to
Sure.
them?
I mean, people, it's not just about getting old.
Right.
If you're having problems, there are relatively easy ways that we can fix most of these issues. Two, it's not about you have to be the tough guy and just take it either. There's plenty of things that we can offer men that give them immediate benefits. It's going to help your quality of life. It's going to make everything go a lot easier for you.
Right. And again, at your practice, you have a full surgical center. Tell me a little bit about that.
Right. Everything we can do right in-house. With urology especially, there's always some privacy issues. You don't want to be in a big hospital with hundreds of people everywhere.
Right.
We try to be discreet. We have a small staff, and this is all we do, and it's all our nurses do. That's all of our staff does, and we're aware of all the ins and outs of the practice.
Right, and this is what you treat every day,
That's right.
in and out. And so I've been making sure we reiterate to men, it's just another day at the office for y'all.
That's
so
right.
not to be embarrassed.
Absolutely not. I say it's like looking at an elbow.
That's right. Same thing. Now, what about, we talked about getting the men to go to the doctor and talk about their concerns, but what about those men who may not have a doctor? Are they able to call your office and get an appointment?
Sure. Very, very rarely does anybody need a referral to come in and see us. Of course, we obviously take referrals, and we encourage you to go through your primary care physician, but you can call our office at 229-883-1503 and make an appointment to see any of us. We can also be reached by email and through the website as well.
Okay, and again, we want to remind them that it's just most of these disease states we've talked about can sometimes be prevented with early prevention screenings. It's very important.
Yeah, like anything else, if you catch it early, it's much easier to deal with. You don't want to wait till it causes significant problems, and we have to deal with those.
And the majority of those screenings you do there in your office.
Absolutely, we do
like
it all under one roof.
That's right. Well, we're going to get these guys to you and let everybody get checked out.
Great.
Thank you for your time and being here today.
All right, my pleasure.
Thank you for watching Healthcare Today. And again, if you'd like more information from any of the physicians that you saw here today, you can visit the website below. Again, it's Albany Urology, located here in Albany, Georgia. Thank you, and we'll see you next time here on Healthcare Today.
If you're a health professional and would like to learn more about becoming a guest on Healthcare Today, please contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
Tired of having to go all the time? Call Albany Urology Clinic today.
Nearly 1 in 7 men will develop prostate cancer in their lifetime, and it's still the #2 cancer killer among men. Here at Albany Urology Clinic, we have over 40 years of experience in dealing with this difficult cancer. As far as signs and symptoms, often in prostate cancer, there really aren't any, and that's why the importance of screening comes into play. It's a simple exam and a blood test that will tell you if you're at risk. Here at Albany Urology Clinic, we offer some of the most comprehensive treatment options that you can find anywhere in Southwest Georgia.
For more information about prostate screening, call Albany Urology or log on to their website today.
Having to go a little more than usual? Well, it's not just because you're getting old.
If you feel like you're missing out on life with frequent trips to the bathroom, come see us at Albany Urology Clinic.